Good morning, Marie. How are you feeling today?
Je me sens un peu dépassée et fatiguée. Mon corps me fait encore mal et j'ai des douleurs dans le bas du ventre.
That's understandable. You went through a big change. How's your bleeding? Have you noticed any large clots or a bad odor?
Le saignement a diminué, mais il est toujours présent. Je n'ai pas vu de gros caillots, mais parfois le sang a une odeur un peu bizarre.
That can be normal, but we'll check to make sure there are no signs of infection. Have you had any fever or chills?
Pas de fièvre, mais j'ai parfois des frissons la nuit.
Okay. Are you experiencing any pain while breastfeeding?
Oui, mes mamelons sont très sensibles et parfois je ressens une douleur vive et profonde dans mon sein quand le bébé tète.
That could be a sign of a latch issue or possibly thrush. I'll take a look and see if there's any inflammation. Are you feeling emotionally okay? Some women experience mood swings or even postpartum depression.
Je me sens très émotive et parfois je pleure sans raison. J'aime mon bébé, mais je me sens aussi épuisée et anxieuse tout le temps.
That's completely normal, but I want to make sure you're not experiencing postpartum depression. Have you lost interest in things you used to enjoy or had thoughts of harming yourself or the baby?
Non, je n'ai pas eu ces pensées, mais je me sens coupable quand j'ai du mal à calmer mon bébé.
That's very common, but you don't have to go through it alone. I can refer you to a counselor if you'd like to talk to someone. Now, I'm going to check your abdomen to make sure your uterus is shrinking properly. Let me know if you feel any sharp pain.
C'est un peu sensible, mais ce n'est pas trop douloureux.
That's good. Your uterus is shrinking as expected. Have you been able to get enough rest? I know it's hard with a newborn.
Pas vraiment. Le bébé se réveille toutes les 2 heures et j'ai l'impression de ne jamais dormir assez.
That's exhausting, I know. Are you getting help from your partner or family?
Ma mère reste avec moi et elle m'aide beaucoup, mais je me sens quand même épuisée.
That's good to hear. Make sure to accept help whenever possible. Even short naps during the day can help. Are you eating well and staying hydrated?
J'essaie, mais parfois j'oublie de manger parce que je suis tellement occupée avec le bébé.
Try to have small, nutritious meals throughout the day. Your body is still healing and you need energy. Drinking enough water is also very important, especially if you're breastfeeding.
Je vais essayer d'y faire plus attention.
Good. Now let's talk about any pain or discomfort. Aside from your abdomen and breasts, do you have any back pain or headaches?
Oui, j'ai beaucoup mal au bas du dos, surtout quand je reste assise longtemps ou quand je porte le bébé.
That's common. Your body is adjusting after pregnancy. Try gentle stretching, using a pillow for support while breastfeeding, and avoiding heavy lifting. If the pain gets worse, let me know.
D'accord, je le ferai.
Are you using any contraception, or would you like to discuss your options?
Je n'y ai pas encore vraiment pensé. Que recommandez-vous?
Since you're breastfeeding, we can discuss birth control methods that are safe for you. I'll provide some options, and you can decide what works best. In the meantime, make sure you get enough rest, eat nutritious meals, and ask for help when you need it. Motherhood is challenging, but you're doing great.
Merci, docteur Sarah. Cela signifie beaucoup pour moi.
You're very welcome. We'll schedule a follow-up appointment in 4 weeks. If anything concerns you before then, don't hesitate to call. Also, if you start feeling overwhelmed or too anxious, please reach out. You don't have to go through this alone.
J'apprécie vraiment. Merci encore.